बता देना मुझे.
Welcome to another episode of our In Conversation live series. Today, we're in conversation with Dr. Mayank Uppal, consultant internal medicine at Sitaram Bhartiya Institute of Science and Research. Dr. Mayank has a keen interest in dealing with infectious diseases as well as managing chronic conditions like diabetes and hypertension. Dr. Mayank also manages the ICU and emergency services at Sitaram Bhartiya, where he plays a key role and works closely with our pulmonary and critical care teams. Today we're going to be talking about critical care and basically how to cope with crisis in critical care with our ICU teams. Dr. Mayank, to begin with, could you maybe tell us a little bit about when a person would require intensive care?
Yeah, so basically, intensive care or critical care is intensive care or a high level of medical care that is provided to a patient, especially in the acute settings, when the patient requires multidisciplinary closed support, which may be in the form of support for the blood pressure or in the form of support for respiratory diseases or support for kidney diseases as well. So any patient who's acutely ill, where the vitals are unstable and the patient is heading towards a life-threatening situation, critical care comes in very handy to provide the interim closed monitoring and care that is required till the underlying disease can be treated effectively.
All right, okay. And in your opinion, Dr. Mayank, does every hospital need to have a critical care unit or intensive care services?
Well, I think it's an absolutely a must for the hospitals to have critical care settings, because even though the patients may be stable and be admitted in general wards or rooms for the treatment of their illness, any sudden deterioration in the medical condition warrants closed monitoring and attention, which can only be provided in critical care settings. And the first few hours to first couple of days of such an acute deterioration are very important in deciding the course of the patient's disease and recovery. And if close support and intensive care is available and provided effectively in the first 24 to 48 hours to these patients, the patients have a very widely different outcome as compared to some patients who do not have access to such care in the first couple of days of their acute deterioration in their illnesses. And hence, I think an acute care setting is very important and is a must to have for all patients who are admitted to any hospital.
All right. You mentioned a few important points over there. Let's say, for example, like you said, the first 24 to 48 hours are critical for any patient that is admitted in the ICU. Talking about that, could you maybe talk a little bit about the kind of super specialty care that is provided to admitted patients in the ICU at our hospital?
Yeah, so what I meant was that for the first 24 to 48 hours, why they are important is because that's when you have to stabilize the patient, because you have to first stabilize the patient enough for the other medications to get time to work on the underlying disease. So hence the patients of ICU may stretch out to be in the critical phase for longer, but for the first 24 to 48 hours is what determines whether patient will be stable enough to undergo the therapy and medications that are required. And you brought up a very important point, because intensive care is not a standalone specialty on its own. Critical care or intensive care is basically amalgamation of various specialities into providing one cohesive, incisive approach for the patient, wherein every specialty takes care of their particular field of expertise, but all that is wrapped around together in the form of one cohesive plan of care for the patient. And that is what we've been focusing on here at Sitaram Bhartiya Institute, wherein different super specialities are involved in the care, but the decision making is joint amongst all specialities, so as to have one common care plan for the patient. And this includes teams of pulmonary and critical care medicine, which is headed by Dr. J.C. Surya and Dr. Ayush Gupta here at Sitaram Bhartiya. We have a medical specialty team, which is led by me, and we have Dr. Karthik Kohli here. Then there is the critical care team, which is held by Dr. Sujan and his team, who are here 24/7 to provide very close monitoring to the patients, and all of them are specialists in their field of care. We have other supports like gastroenterology and 24-hour endoscopy services available for the patient, nephrology in the form of continuous renal replacement therapy, and dialysis facility available 24/7 for our patients admitted to the ICU. We also have facilities like bedside bronchoscopy, etc., available for the patients. So basically, we strive towards providing one point of care for the patient, and also strive to have a cohesive care plan for the patient, so that every opinion of the specialities is amalgamated into one care plan for the patient, and there is no confusion on that front as far as the management is concerned.
All right. Okay. I think that you covered all of those points well. Dr. Mayank, also, can you maybe talk a little bit about how exactly the care that we provide at Sitaram Mritya might be different from other hospitals?
It goes without saying that we follow the standards of care, internationally accepted guidelines for care for various conditions. That's the least measure of precision that we expect from all our doctors as well as the nursing staff. I would mention here that even the nursing standards here that we follow are international standards of nurses to patient ratio. Hand hygiene and infection control practices are also as per the international guidelines. So those are the basic steps that we take care of, and basic amenities that I think are the basic founding stones for the good critical care for the patient. But what we strive to do a little differently here is that we try to understand, and we understand that critically ill patients are a serious stress on the family in terms of the psychological impact that it has on the whole family, other than of course the financial impact and the fear of separation from the patient that the attendants suffer from. So in that essence, we have we have good access that we provide for the patients, attendance to the patients, of course taking care of the infection control practices at all time to minimize the spread of infection in the ICU. But we try to minimize that by providing regular access to the attendants to their loved ones. Also, they have access to their treating doctors twice in a day, where we are able to answer all their queries, questions, doubts, and anxieties. Also, to keep them on board with the care plan that we are following for the patients. Even the nurses are always available at the bedside when the attendants are visiting the patients, so as to provide basic small things that the attendants are worried about, things like whether the patient has been eating well, whether the patient has stools, urine, etc. The basic concerns that the attendants have, the nurses are always there to address these things. And I think these small things go a long way in keeping the attendants as well as the patients motivated enough and keeping them anxiety free, because as it is an acute illness, is a lot of stress. So we try to minimize that as far as possible by facilitating communication between the patients, attendants, doctors, and the nursing team.
All right. I think you brought up some good points there as well. In terms of like how you mentioned, there is a lot of psychological stress as well as the anxiety of separation from a loved one who is admitted in the ICU. From that perspective, could you maybe, give a little bit of guidance to people who do have loved ones admitted in the ICU now, or maybe, at a time in the future, if they ever do come across that situation? How would you suggest that patients of these families of these patients sort of deal with this situation? Is there anything that you would like them to keep in mind?
I think there can be no one perfect answer for the situation, because critically ill patients, all of them are different from one another. All of them will have different kinds of medical issues requiring variable periods of admission to the hospital, and various levels of intervention required to provide them the care that they need. So there can be no one perfect answer for this. But as far as the attendants are concerned, I think a few pointers that I would like to give them are that I know that all the attendants, we understand that the attendants go through a lot of questions, doubts, queries, anxieties in their mind when their patients are admitted in the ICU. So one good thing could be that the patients, and I always encourage the attendants also to do that, is to note down whatever queries, questions come to their mind on a piece of paper before they come and see the doctor. Because in the 5-10 minutes that you spend with the doctor, you might not be able to recollect and ask all your queries, and then some of these unanswered queries might be the reason for your anxiety, and then you would frequently try to get in touch with your doctors, and that probably would lead you to be a little dissatisfied or feel a little more anxious. So it's always good to jot down all your questions. Even your doctor would love to answer all your questions if you have them written down, so that he can systematically answer all your doubts and queries there and then. So that is one thing. The other is that always we encourage the attendants to be very open about all the medical histories that they have, the relevant medical histories that the patients may have, and to bring in any reports, etc., in the previous ailments, because many of these patients may have had encounters with the healthcare system at various points in their life. So all those records are very valid or valuable in sort of going a long way in treating these patients. So I think these things, and of course, it's hard, easier said than done. It's hard to be patient when your loved ones are admitted to the ICU. But patience is one thing that you have to understand and cooperate with your healthcare providers, that they are trying to provide the best care possible. But of course, you have a right to be a part of the decision making in terms of the treatment provided to the patient, and we always welcome you to ask questions and be informed about these decisions. But I think these are 2 points that I would like to highlight for the attendants.
All right. Those are again very valid points. Could you also maybe talk a little bit about how the situation is different now as compared to during the second wave of COVID, in the sense of with respect to ICU care, about how we've sort of learned from that situation and how we're moving forward in terms of sort of improving our standards of care?
So COVID-19 did provide unprecedented challenges to the healthcare system all across the world, not just in India. The second wave was really hard hitting, and it really overwhelmed the system. The second wave also brought with it more critically ill COVID-19 patients, and hence the need for critical care services and ICU beds was, unforeseen, and sort of overwhelmed the complete capacities of not just the government hospitals, but even the private hospitals were stretched to their limit and even beyond in providing care to these patients. But I think, luckily, with the government and the people in general cooperating with the vaccination drive is progressing well. So luckily, the number of COVID cases has been progressively climbing down. So it's a good relief that we don't see so many patients needing admission to the hospital anymore with COVID-19, and we hope that it stays that way. But one or two important lessons that COVID taught us is that critical care does form a backbone of any such epidemic. It also forms the backbone of all critically ill patients, and hence the need to rationalize provision of critical care for the patients was very important, because every time the free availability of beds might not be there. This was something that we had already been practicing at Sitaram Bhartiya Hospital, and that helped us in COVID-19 and has also encouraged us to strengthen our systems on those lines further. And I'm talking here about the triad system that we've been following right from the point that the patient comes to the emergency department, to ensure that only those patients that require admission are admitted. There are no unnecessary admissions to the hospital, and also the level of care that the patient needs to be admitted to is defined there and then, so that a patient who requires admission to ICU is not admitted to the room, and vice versa. We don't want excess admissions in critical care, and we don't want false or wrong admissions in the general care settings. So that triage was already embedded in the system. The nurses in the emergency department, the doctors on duty in the emergency department were already tuned with it, and hence when the COVID wave hit, we did struggle. I would not say that we didn't struggle, but we found it a little easier, I think, as compared to the others, to adjust to the huge inflow of patients that happened. And eventually also, when the patients are admitted to the ICU, we do a daily assessment and reassessment of the patients to see whether they still qualify to be in the ICU, or whether they can be shifted out to the room for being closer to the patient's attendants, and also for the cost of care that can be sort of saved for the patient if the patient is moved out of critical care. And this daily assessment and reassessment is openly shared with the attendants of the patient on everyday morning rounds, to tell them what has changed in the last 24 hours, and why, if the patient still needs to continue to be in the ICU, and if the patient can be shifted out of the ICU. So that is openly discussed with the patient, so that the attendants and the patients have a lot of clarity and control over how their care is being delivered to them.
All right, okay. And so you also mentioned the role of a nurse, at the starting point, say, for example, when a patient comes to the emergency, about how she is supposed to sort of triage along with the doctors. Could you also maybe highlight the role of a nurse in intensive care in that kind of a setting, about how, what kind of a role they play, how important their role is with respect to patient care?
So critical care nursing, nursing in general forms a very important part or aspect of medical care delivery. But in critical care, nursing if I may say so, be as equivalent to being the backbone of the care that the patient receives in the ICU, because the nurse is at the bedside of the patient 24/7, is looking at the minor changes that are happening in the condition of the patient, is responsible for maintaining not just giving the patient medications and giving the patient diet, etc., but also in maintaining proper position of the patient in the bed, turning the patient, infection control practices. So these are very small things which may not seem very important, but in the overall scheme of things, these small things matter a lot in how the patient comes out of this critical illness. Medicines, I would say, just from perhaps medical management medicines, etc., perhaps just from about 30 to 40% of the total care outcomes. Rest of it, about two-thirds of it, is formed by how good your nursing care is for the patient. And in that essence, I think we take care of regularly training and retraining our nurses on the job, to keep them updated with the current guidelines, as well as in ensuring that advertently or inadvertently they are not following anything which is not good for the care of the patient. We have regular training exercises for the nursings. All our nursing staff that are posted in the ICU are accredited for critical care by the Indian Society of Critical Care Medicine. So we try to maintain those standards because we realize and understand that nursing is a very important part. And I think most of our patients appreciate the nursing care that they receive here, especially in comparison with other hospitals that they might have been in. And we try to provide not just medically precise care, we also focus on providing compassionate care for the patient, because at these in these settings and in these critically ill times, psychological support is something that the patient really needs, and which really helps in keeping the patient motivated to carry on with the treatment required.
All right. I think a lot of our patients will be reassured to know that our nurses are trained rigorously and regularly in critical care, especially. Dr. Mayank, also, this might not be a very appropriate question, but say when someone approaches a doctor for treatment, and they're not very sure of the treatment that the doctor has advised them, they then go for a second opinion. With keeping that in mind, is that something that you have seen regularly or sometimes in intensive care requirements as well? Is there a possibility that someone who has been advised ICU admission might then go and seek a second opinion about it?
Yes. So, as in all conditions, in critical care, it's even more so because the patient is critically ill. Things don't seem to be getting better for a certain period of time, at least in many of the patients. So, the attendants are bound to get a little anxious and want to see an opinion whether the care that is being provided to their patients is going in the right direction. So, I think it's very valid and very logical to understand that the patient or the attendants would want a second opinion. We see that very often in critical care settings, especially. So we do see a lot of patients coming into our hospital as well for second opinions. To the attendants who might be in such a situation and wanting to seek a medical opinion, I would suggest that they get a medical summary of the patient from their treating doctors, because that is the information that really decides of how the patient is and what can be done best for the patient. The attendants may not have the complete information, or the patients may not have the medically precise information to make such decisions. So always a medical case summary for such patients is very helpful in deciding and giving a valid second opinion to the attendants. Again, critical care, I would say, is if I may say so, a puzzle where a lot of things have to come together to solve the puzzle. And these things are not just limited to one small medication or one small part from the doctor. It is holistic care in terms of even sometimes the attendants have to be party to certain decisions, because a decision A and a decision B could be equally good for the patients, but may have different chances for the patient. And sometimes it's very important that the attendants take the call on which decision direction they want to go with. So in that essence, also keeping the attendants involved right from the very beginning in the care plan for the patients helps in keeping them informed, and therefore the anxiety for seeking a second opinion usually is lesser. I think in our settings we do not see a lot of patients wanting to seek second opinions from other places, because they have a lot of clarity all along the way as to what is going on with the patient, and what are the realistic chances of the patient recovering from the illness or otherwise.
All right, okay. And I think we've had a quite an informative discussion so far. Is there anything else that you think patients should know either at the time of admission or for their families to know while the patient is in the ICU?
Well, so again, like I said, every patient in critical care would be different and unique, and would have different set of medical conditions that would need different levels of and different levels of care and different duration of stay in the hospital. But like I said, we at least here in our center encourage the attendants to meet us regularly on the morning and evening round, so that we can update them about the situation. We are more than happy to do it. In fact, we want to update the attendants, because once the attendants, the patients, and the medical team is on board and are on the same page in terms of decision making, it is easier to take quick and better decisions for the patient's care, rather than the confusion of having to go back and forth when the attendants are trying to find the doctors and the doctors are trying to get decisions out of the attendants. So it's always better, and we encourage the attendants to do that. In fact, we have a separate conference or an interaction room with the attendants, where we do daily monitored counseling. We also have multidisciplinary team meetings, wherein all these specialists involved in the care of the patient come together in one room with the attendants, so that all the doubts, queries, and the care plan, etc., can be discussed there and then on the spot, without any confusions of the attendant having to rush to different doctors to understand the care of the patient. So we have these multidisciplinary team meetings with the attendants, depending upon the criticality of the patient situation, sometimes daily, sometimes twice a week. So I think we try to keep the patients informed on that matter. So to the attendants, to answer your question, I would say that please be available in the hospital at the specified times. And I'm talking here about our center, because we do it in a very disciplined manner. So please be available here with us, and we will be more than happy to share the information regarding the patient's conditions with you. We are also very open about disclosing the medications, the investigations, and anytime the attendants wish to know what is going on, we are more than willing to give away our treatment records, etc., for the patients. So it's all very clear and transparent, because we do follow certain standards of care, and we really feel that sharing it with the patient is, it's not a secret, so it's no harm sharing it with the attendants or with the patient. So I think that really helps in keeping us and the attendants on the same page in terms of managing the patients.
All right. I think that is very informative again and very reassuring. And I think most patients would appreciate the fact that we follow such a transparent approach and that we believe in really keeping the patient informed and their families informed of the progress that the patient is making and involved in their care. Thank you so much, Dr. Mayank, for joining us today. For our viewers, if you have any questions that we have not taken up as yet, please feel free to drop us a comment and we will get back to you by the end of the day. Till then, till we have our next session, we will hope to see you again soon. And please feel free, like I said, to drop in a comment on any of our platforms given here. Thank you so much, Dr. Mayank. Thank you,
Thank you so
everyone.
much. Thank you.